I've been using telemedicine probably for the last 4 or 5 years. Over the last month, due to the COVID pandemic, I've increased my number of telemedicine visits approximately by 50%. Definitely the use of telemedicine has increased and has actually allowed me to examine patients that I wouldn't otherwise be able to examine. We are able to see upper respiratory infections, rashes, mild cough. Even if a patient is having an asthmatic exacerbation, I've been able to manage these with the use of telemedicine. This will allow me to determine if the patient needs to go to the hospital or not, and what treatment modalities needed to be used. A good example is a 3-year-old known asthmatic who mom calls me and requests a telemedicine visit because of the cough. Knowing the history of the patient, determined that the patient was having an acute asthmatic exacerbation, described the mom how to use a nebulizer, and it was able to e-prescribe steroids to help improve the breathing of this patient. In the subsequent days, I was able to follow up and determine the patient was indeed improving and the work of breathing was significantly less, and therefore prevented an ER visit and an ER admission. I encourage everybody to continue to try telemedicine. Think of it as another place of visit for your patients. You see them in the hospital, you see them in your office, and now you're seeing them in their home.